Hello, everybody. Megan Thompson here, and with Megan Thompson Coaching, and we are here helping parents of sensitive kids eliminate the daily meltdowns, end suicidal thoughts, and stop explosive behavior. So, just to introduce myself. I am a registered play therapist, supervisor, a licensed clinical professional counselor, and I've been working with parents and children for the last over 10 years now at this point. So, when we think about what's going on for today's topic, I really wanted to address a couple of red flags that I've been hearing parents talk about, as well as what sparked my need to go live tonight, which is a conversation I was having with one of my therapists. So, I run a private practice in Maryland and then also work in how you know me here is through the coaching business. So, one of the things that I think is important for parents of highly sensitive kids is determining when and how and through what you need to, when you need to seek professional help, what your avenues are and where you're going to get the results you need, right? So what I want to do is talk about the importance of what type of mental health support makes sense for your particular family and what you need to watch out for. And so when we think about parenting a highly sensitive child, a child who feels big feelings, thinks about things deeply, is emotionally overreactive compared to the 80% of the population, who is empathetic in some situations or paralyzed by empathy or overstimulated in other circumstances, and then also sensitive to little things, right? It's super important that when you work with a professional, they understand the trait. Now, I think about one of the things that really drives me nuts in the mental health field is the mismatch in understanding the impact of parenting and a child's mental health journey. Now, when we think about mental health, what we're talking about is addressing anxiety symptoms of depression, perhaps symptoms of trauma, a diagnosable mental health disorder where a child is inhibited by their own emotional state on a regular basis, more often than not, so much so that they're not able to follow through on their daily tasks. Now, when you think about how your child is being highly sensitive and that being part of their personality and how they might also fit in this category, it's super important to know that you're working with somebody who can guide you in understanding what's about their personality and what behaviors are a symptom of the relationship that you have with them, and that being disconnected or not being effectively managed in a way where you can lead your child in managing their own emotions, rather than diagnosing your child with a mental health disorder that may or may not fit because the therapist is not clear on the personality trait and how that can lead to developing a mental health disorder or can be misguided or misdiagnosed as a mental health disorder. So this is our mission. We're helping parents end suicidal thoughts for their sensitive kids because we know that it eventually gets there without addressing the core issues that sensitive kids have in terms of struggling with managing their big emotions. So when we think about some of the red flags, and again, just to remind you, definitely say hi if you're here live, post hashtag replay if you're catching the replay. We want to see what you're commenting on, how you're listening. I pay attention to that. We all do. And we're focusing on how we can best support you here while teaching you what works, right? So the focus is first and foremost for sensitive children is making sure that you're working with somebody whose primary focus is on the parent-child relationship. Now, one big red flag that I see a lot of mental health therapists work towards and perpetuate is this lack of involvement of parents in the therapy relationship with a child. So one thing that I think is super important when you're parenting a sensitive kid is the fact that your child and their emotional state is actually impacted more so by your relationship with them than by anybody else's. So if that's the case, and you have a professional who wants to help you in guiding your child and managing their emotions, and they want to help your child in guiding themselves to manage their emotions, but they're meeting with your child alone for 90% of the treatment, or all of the sessions without giving you any direction. I was just speaking to a family earlier today where their child had been working with a therapist for the past several months, and they had no idea what they were working on. There was no development of a treatment plan, there was no communication on goals, no follow up on what they were talking about. So the parents were having to quiz their child on what they were addressing in session, this child, who, as a result, that creates a dynamic of who do I trust and who's running the show here. So when your child is experiencing big emotions, you need to know that the person that you're working with has a plan and a repeatable plan. So there needs to be a strategy that they are effectively creating and recreating and reiterating with their families that they work with so that they know how to get you from A to Z. Huge red flag if the professional that you're working with does not involve and prioritize a parent component when you're working with sensitive children, when you have a sensitive child and you're working with a professional. So that's super, super important. One of the things that I've learned over the course of my career is that it really is a big disservice to parents to think that that you need to defer to the professional in a way that actually puts you in the back seat or even the trunk of the therapeutic relationship that your child is developing. Because quite frankly, for sensitive children, the therapeutic relationship is actually fostered, and the results of a therapeutic relationship, which is feeling better about themselves, communicating their emotions in a developmentally appropriate way, naming and advocating for their needs, right? That's what you want if you work with a professional, if you have the need to work with a professional. That therapeutic change has to happen through the parent. And so when parents come to us in the private practice, we have to do some educating around that. And that's normal because, unfortunately, a huge red flag in the mental health industry for children is this concept that the professional is going to assess the child, build a relationship with the child. That needs to take weeks, months, before the child starts to talk to them about their worries. And then the child is able to communicate, and the therapist can guide them in making changes. Now, that works for children who are traumatized. That works for children who have a history of generalized anxiety. But for sensitive children, it doesn't work. I'm not going to say any way around it. That is definitive. It doesn't work. I have to say that because I've done it before and I did a crappy job without knowing it, right? So I had spent years trying to figure out why children who were sensitive weren't making as much progress as the children who weren't sensitive that I was treating. I've also lived it. My sister, who's sensitive, does not understand and significantly struggles with being able to learn a skill and then implement it in various aspects of her life. So, and we see this repeatedly when teens come into our private practice because of the years where they've been struggling to generalize skills, and parents just not really knowing how to lead them and struggling to try and implement skills that they may be reading or advised upon without a repeatable system. And so it creates this situation of throwing everything at the wall to see what sticks. Now, when we do that educating, as I was speaking about with parents, there's a little bit of support that needs to be put in place for parents to understand that the change comes through you. And so we work that out, right? It takes a conversation or two because we know what we're doing. But it's really important for you in terms of working with your child and managing the support that you might have in place, but that the person that you're working with is not leaving you in the dark, is not trying to build a relationship with your child and get to know your child through your child, because who has a big picture view of what's going on? You, as the parent. Your child is struggling, absolutely, and they have a voice, absolutely, and it's also true that they are stuck in the middle of the vortex of their emotion. And so just by nature of developmentally struggling with managing, being able to show you the big picture and tell an adult the big picture, as well as being a highly sensitive child, they are going to significantly struggle learning about emotions, and then translating that into the household in order to communicate and advocate for their needs in a developmentally appropriate way without you being consistent and leading the process. And that's just not going to work if you're not in the office with that person. Or, I mean, now that telehealth has given you a little bit more freedom in terms of who you can choose to work with in your state if you go that route of finding a local therapist, but it still puts you in the back seat or the trunk if you're not focused on acknowledging that that's a huge red flag. Another red flag that I think is super important for parents to understand is any use of behavioral strategies to manage behavior. To change behavior in a child. So what this means when I say behavioral strategies, I mean sticker charts, reward charts, chore charts, acknowledgement of levels. Those are systems that are usually more relevant in schools. But paying attention to, if you do this, then you get a reward. Guys, I can't say this more than I have already. Your child is not a dog, so you can't clicker or train your kid. It's super, super important that if you're working with a professional who is telling you that behavior intervention like sticker charts, etc., is going to get you the result that you're looking for, then you're not working with a therapist who understands sensitive children. Because what does that do? You want to think about understanding that we as adults can be motivated by knowing that we have a goal and we're here and we want to reach here. But if we don't have the skill to get us here, like there's a gap in a skill development, then we're going to feel really frustrated about trying to jump up. It's like, you're a kid, like an adult, and you're trying to reach to hit the ceiling and you can't reach it. And no matter how hard you try, your legs just don't have the muscles to hit the 10-foot ceiling. And so you keep trying to reach that goal, and then you start to jump less. And then you start to think, well, wait a minute, here's my goal, but I don't know how to get up there. And as an adult, maybe your life experience may demonstrate, oh, okay, maybe I could go find a ladder or a pogo stick, whatever, like you can get creative. But if you don't have the emotional capacity to notice your emotions and then think creatively, then you're going to get frustrated quicker. And you're also going to feel stuck. And when you feel stuck, what do? You can give up. So it creates a situation that we always see with parents who have started to use reward charts and sticker charts, etc., with their kids, likely usually at the advice of a therapist or a mental health professional or even a pediatrician, etc., is that their child ends up melting down when they don't earn the sticker. Now, if you think about a dog and you're clicker training a dog, the dog doesn't understand, or, they get a treat. They don't understand that they didn't get a treat, but they also don't really realize that the treat's there. They're just trying to figure it out. So I'm just going to use my dog Porter, who's like an adorable little thing, but he's also a super wiggly wiggle butt, right? And he's excited and he's pumped and he's a perpetual puppy. Now, when he was an actual puppy, he's 5 now, I think. I'm just doing the math in my head. He's 5.5 now. So when he was a younger puppy, he would sit and he would be like, it got ants in his pants. And so if I was focusing on the fact that he needed to actually sit still, then I would miss the opportunity of observing that he was doing the best he could. Now, a sticker chart is very definitive. Okay, there's no wiggle room and room for development. And so what happens is that your child, as they jump, as they try to reach that level, to go back to my earlier metaphor, is they are discouraged and frustrated before they get it, right? So it backslides and it backfires. Now, thinking with a dog, the dog is excited, they say sit, they hold the treat, and they're like, oh, okay, and it takes them a while, and you're practicing over and over and over and over again, but their emotions are not as complicated or as deep as your sensitive child. So why would we be using the same level of system? I want to use another example that is probably going to feel more relevant, because I know that, when we use the concept of animals versus humans, it brings in other variables that we want to ensure that we're not taking in. One of my earliest positions was I was an intern in high school working at a residential treatment center for traumatized children. So I was an intern, and I was shadowing the behavioral support staff. So these are the staff who were assigned to make sure that they were supervising the children at all times. And these were children who had experienced severe trauma, neglect, and may or may not have had, born into a drug history, where their mom was addicted to drugs, and or were removed from care because their parent was addicted to drugs, and they were removed from care and put into foster care or family care. But because of how traumatized they were, their behaviors were out of control. They weren't able to control their own behaviors, and without the skills and support, it was deemed at some point in their childhood that they needed to be in a locked door facility. So what that means is that the children were living outside of their home and away from their families, or for those who are in foster care, with no identified family, and that they could have contact with or could feel support from. And then they were parented or guided by staff members, right? So doing shift work. And so observing that and seeing where the kids were struggling, one of the things that was really frustrating for me, even as a high school student, was seeing where kids were stuck and how it was so difficult and hard for them to reach the goals and the expectations that were set for them. And one of the things that was very clear on how stuck they were and why it was so clear to me was because they had a sticker chart on the board. So there was on the hallway, there was a chart, like red, yellow, green zone. And so they were on what's considered a behavior chart, and they would earn points throughout the day to for positive behavior. And then then they would stay on level, and if they could stay on level for a certain number of days, red, yellow, green, then they would earn privileges. And so there were certain levels of privileges that they had. Now, when we think about children who are traumatized, it's like going through life with as if you don't have an extra layer of skin. Every little thing is going to have a higher impact in bothering you. And we can see a parallel with sensitive kids too. So this is why I'm getting here. I'm going somewhere with this. Now, traumatized children who struggle significantly with trust and struggle significantly with being able to manage their own behaviors, because not only do they not have skills, they were also taught to really ineffective skills just by nature of what was modeled for them at such an early age. And so they were put in this position to manage their behavior and to do it effectively, repeatedly, and like on a strike you're out system, right? Because you lose points, you move down a level. And what we see what I witnessed with these children was that when they moved down a level, they lost their minds. I mean, it was just devastating to them, because what it meant was that there's something, that a loss of privilege tied to moving down. But that's not just it. It was also, I can never get out of here. I can never do this. And so that emotional experience for traumatized children is also what your child is experiencing when you use a sticker chart. So if it doesn't work with kids with severe needs who have the highest needs of changing their own expression of their emotions, and have the highest needs to be able to and need the highest level of care and support and love and communication, if it doesn't work for children with these histories, why would we think that it's appropriate for your children? I want to really flip that on its head, because sometimes we think, well, it doesn't work with traumatized children because of their history of trauma. But what if we consider that it doesn't work for any child to be held to a standard without a skill, and then being told, if you don't have that skill, you lose privileges? So that's red flag number 2. I just hands down don't believe that sticker charts were going to get you anywhere. Number 3 is planned ignoring. So this is one thing that drove me nuts today. I was one of my therapists is at a training working with traumatized children. She's getting more intensively trained to do that. And she sent us a message that and these two are related, that the trainer, so remember, let me clarify. One of my clinicians, she's at a training. She's been working in the field for, we went to grad school together actually, so 11 years at this point. And she is receiving intensive trauma-focused training which is considered an evidence-based treatment to support children with in resolving their emotional connection to trauma, so that they can then process their traumatic events in their life and move through the emotion, so that they can feel empowered to manage their lives and know that trauma is part of their life but doesn't define their life. So I'm not going to name the level of treatment, but it is a highly widely used type of treatment that is evidence-based. What that means is that there's been lots of studies on it being effective in helping children heal through their trauma and be able to manage their behavior. Now, this type of treatment is also touting the use of what's called planned ignoring. Now, planned ignoring is when your child is doing something to demonstrate a need, melting down, getting aggravated, frustrated, not communicating in an effective way, yelling, etc., that the person, the parent in charge of this child, in charge of leading this child, is to ignore it. So it's super important to understand that is actually perpetuating another traumatic experience for children, because when you ignore a child when they are at their highest of need, you are actually shutting down your emotional connection when they need you the most. So red flag number 3, if a therapist is telling you to ignore, or a mental health professional at all, coach, whatever, is telling you to ignore a child's intense behavior, then that is not going to work. It actually teaches your child that when you are on fire emotionally, I don't pay attention to you. Just hearing that sounds so hard, right? So definitely a red flag. And because sensitive kids are picking up on this, they are noticing that is not how they want to feel. They are worried about their relationship with you as their parent, and it further tears apart the strings that are holding you guys together when you feel disconnected. Because if your kid's having an emotional meltdown and you don't know how to help, that can create a lot of frustration for you, exhaustion, you're tired, you're also worried, and your heart is breaking. And when that happens, your relationship with your child, while you love them very, very much and thoroughly and in a very focused way, can also be felt on rocky ground because you don't know how to lead them out of their emotions and teach them how to manage them safely and leave them out of the ineffective behaviors that they're showing you. And so it can feel like your relationship at times could be hanging on a string. And if when they need you the most, you are, still-faced, then your child is feeling completely abandoned in that moment. And I'm going to use that word, and I know it's really strong, but it's an emotional abandonment, and it's not going to work. And we see this. There are studies done in infants where their mom was. It's actually called the still face experiment. You can find it on YouTube. It's really hard to watch, so don't go looking it up on purpose if you're a sensitive person yourself. But we know that children need interaction when they are struggling the most, and when parents shut down their emotion and ignore, then it creates a lot of distress for children. So that's number 3. Number 4 is timeouts. It's another one that this treatment is touting as a good idea. And you guys have heard me speak about this before, so I'm going to keep it pretty brief. Sending your child away to manage their emotion when they are struggling the most, if their emotion is leading to ineffective behavior, still feels like neglect for your kid. So they're being punished, they're being told that they're not good enough in some way, shape, or form, or they are interpreting it as that. And you can't have a kid who feels like they're not good enough be good enough to do what you need them to do. It just doesn't, the logic doesn't compute. If they think that they're not good enough to do what you need them to do because you're sending them away in a timeout, then they won't feel that they're capable of reaching your expectations. So they either give up or they stay stuck in their pattern. And so it totally circumvents your end goal as a parent of a sensitive child, which is to help your child feel better about themselves, so much so that they guide their own behavior to safely communicate their needs. So timeouts will not perpetuate the goal that you're looking for. And then lastly is medication as the second shop. Now, I use this when we think about mental health providers who struggle with teaching a system and being able to repeatedly get success for parents of sensitive kids. Usually, they are the anomalies on the caseload of a professional in this capacity, who then, because that child is struggling so much and they have their typical tools in the therapist's toolbox aren't working, then they say, you know what, they must need medication. And if that's the next route that they take without addressing any other environmental change, or especially if we talked about flag number 1, not working directly with you consistently on a weekly basis in a more pointed and effective way, then, other than just check-ins about how things are going and like a tip or two or nothing, just hearing from you so that you, like, allowing you to vent, or giving you an update on like what they talked about, the professional and your child, then using medication as a second avenue of support really means that their first avenue of support wasn't actually effective. And so what they're saying at that point is, well, this isn't working and it's supposed to work, so then let's use medication. When they should be saying, this isn't working because it doesn't work. Let's try something else. So I think that's really important to understand when you're working with a professional. You want to ensure that they understand the highly sensitive trait, to sum up. You want to ensure that they know that that means that parents need to be involved regularly, consistently, and more thoroughly than the child and therapist working on their own. And then also that they are not teaching any behavioral interventions like sticker charts, reward charts, chore charts, etc. And that they're not teaching you anything that rejects your child when they're needing you the most. So like planned ignoring or timeouts. All right. So that's to summarize all of what we talked about. If you guys are focused on what is working, definitely go ahead and check out the masterclass. We know exactly what to work. There's a whole 45-minute training on that. So not the focus of this, but really what it is making sure that you are managing the fact that your child goes straight to shame, changing the relationship with you as their parent as being the real true avenue for change, and then including play in managing their emotions. And we break that all of that down in the masterclass that you definitely have a link to at this point. Now, if you've been trying to do all of that on your own and you haven't been able to figure out how to get that to work effectively so that you have eliminated daily meltdowns and you've been able to perpetuate that system for more than a week, then you definitely should be reaching out for a conversation at this point, and we can decide whether or not we're a good fit to work together and how we can help you. So what you're going to do at that point is go head over to meganthompsoncoaching.com/talk, and we'll have a conversation with you. A member of my team or myself, we will discuss whether or not where you're stuck, where you want to go, what your goals are, and where the gaps are, and how we can help you. And if that's the fit, we'll tell you how that works. If we feel like there's going to be a more appropriate avenue, like therapy for your child, or perhaps taking an avenue of a different professional, then we tell you that, because it's really important that we ensure that you get the results that you're looking for. And if that doesn't mean it's us, then that's totally fine. With that being said, we don't know whether or not that's going to work for you until we get to know you and speak with you, and whether or not you're a fit, right? So I'll go ahead and post that link in the chat below. It was great speaking with you guys, and look forward to speaking with you soon. Okay? All right. Yeah, let me see if I can get this link up here before I pop off. Oh, I think I'm going to just do it afterwards because I'm taking too long with dead air here. There we go. All right, guys. Check you later. Have a good night. Bye.